Hello, hello, hello. Welcome to Be Bold America. I'm your host, Jill Cody. Be Bold America is a live bi-weekly talk show for those who are motivated to step out with the bold actions necessary to reunite this country, fight for democracy, and learn what they can keep doing, stop doing, and start doing to reclaim our democratic republic. Our future depends on it. Our program today is The Pandemic and Democracy. Democracy is being challenged by a pandemic. As a previous guest on this show, Dr. Ruth Ben-Gayat recently stated, authoritarian leaders staying in power nearly always trumps the public's welfare, and the pandemic may prove the ultimate test of democracy's ability to endure. Our guest today, Dr. Peter Levin, stated, the COVID-19 pandemic challenges not only physicians, public health agencies, scientists, and ordinary people, but also democracy. Dr. Levin will also explain facts such as how to diagnose the coronavirus, how it spreads, and why vaccines are so difficult to produce. We have big things to do. Dr. Peter Levin is a doctor of science and is a former dean of the schools of public health at the universities of Oklahoma, South Florida, and SUNY Albany, where he initiated the Center for Public Health Preparedness and Public Health Leaders of Tomorrow to train current county health employees. He was health policy counsel to Senator Connie Mack, Republican from Florida, and chaired the Florida Hospital Cost Containment Board that approved all hospital budgets in the state. More locally, he was executive director of the Stanford University Hospital. As a public health graduate of Harvard, Yale, and Johns Hopkins, he is now a public health consultant. Welcome to Be Bold America, Dr. Levin. It is an honor to speak with you. How are you staying at home? How's it been these last 2 months for you?
Well, it's really not been bad. Thank you very much, Jill, for inviting me.
You're welcome.
We have beautiful weather down here, and I can go out to jog or walk around in areas where there really are almost nobody else around. So it's been California life, I must say. It would be very different if I was in a more urban area with a constant need to go out. So most of us, many of us are retirees down in California. It's quite easy for me to survive.
Well, it's nice to hear that you've been handling it well. And to dive right in, what are the differences between COVID-19, the flu, and other viruses-caused disease?
Well, it's really a matter of severity. We all know that a cold will go away in 5 or 10 days. You have a runny nose, you have a headache, you may have some aches. But the flu, all these become much more serious. A splitting headache, a high fever, it's really a much more severe illness that very often in the past settled in your lungs. With Corona-19 here, we have a disease that affects the brain, the cardiovascular system, the kidneys. It's a really terrible disease, and people shouldn't be casual about it at all.
Well, how is it spread, and how was the effect on the spread by the Trump administration not responding for a couple of months with a coordinated national and proactive response strategy?
It's spread by essentially droplets. Things that come out of your nose, out of your mouth, that go out into the air, and people breathe them in. Yes, they can survive on various surfaces, but primarily it's droplets that you breathe in. And in the case of the Trump administration, the president closed off the country when it was appropriate. But the whole ability to contain this disease is by not having people circulating around and breathing air from one another. And what slows it down, and we now have enough time to see that this is really the truth, is that when people are not circulating, when they wear masks when they go out, the disease does not spread as much as it does in more contained environments. One of the reasons that New York City has been so hard hit is the fact that people live in apartments, they're in elevators together, they're in buses and subways together, they're on the streets, many people at the same time, and it's spread. And whenever you can keep people at home, keep them out with masks on, the disease incidence definitely slows down.
I've heard that it hangs in the air for 3 hours. Is that true? Say if somebody sneezed or coughed, that aerosol droplets hang in the air for 3 hours. So somebody could have been there an hour and a half before you walked into a store or a restaurant. Is that true?
Well, theoretically, yes. And in certain circumstances, yes. But, there are cross currents blowing in the air. There is sunlight. There is movement. And so I think it's unfortunate if people think that anywhere that a person went, and if they're infected, that's going to remain around for hours. By and large, life is safer than that. Theoretically, put somebody in a room without any air blowing around and have them sneeze and cough and whatever, yes, it probably does stay in the air, but that's a very theoretical situation.
That's nice to hear because we don't want to foster paranoia. We want people to be calm and rational and smart, but not paranoid. And I think hearing that we don't have to worry about it, even though it might hang in a very tight room is possible, but probably if you're out and about, it's not really going to happen.
That's correct. And the wind, a day like today down here, the wind is really blowing, and droplets aren't going to be waiting for you to come along after somebody breathed or sneezed, 15 minutes ago. They're just not going to be there to any degree.
So what have we learned about this disease from people who've had it so far?
Well, it's a terrible disease, and at first we thought it was just going to get into people's respiratory systems, and people were having terrible problems breathing, and that's why the whole discussion of the need for respirators came out. But actually, the disease is worse than that and goes after different systems in the body. And the respiratory issue certainly hasn't gone away, but there are other parts of it that are equally as dangerous. And so I would say what we've learned, and the only way you learned this was by having lots of people come down with the disease and many people having to treat them, that we learned this. We did not know this ahead of time about COVID-19.
Well, I've heard about blood clots, that's an issue also, but I just read something recently that what they're finding in children, I'm kind of reaching in my mind on what that was now. I think it was inflammation, but how's this affecting children? What's new?
Well, yeah, their children have had circulatory problems in the sense that it mimics a disease called Kawasaki disease, which causes inflammation of the lining of your blood vessels. Now, this is not what every child gets, but this is a possibility, and it's also affected adults' circulatory systems as well. So these are these strange things. They don't happen to everybody. It's not like certain other diseases where you know what the course of the disease is going to be because everybody has it pretty much the same. There was all kinds of things about children's toes changing color, and some of this was due to clotting. And these are all things that, as the disease has progressed and people have treated more victims of it, more information about different things that the virus has done has come out.
So what other things have we learned? I think that there are some people that seem to get it, and it's not as difficult on them. And then there's others that go in the hospital and will be on a respirator for weeks and then pass away. Do we know yet why it's easier on some than others?
I don't think so. I think that's one of the mysteries, and especially all of a sudden, a 20-year-old seems to be getting better, and the next thing you know, they die. This is the kind of thing that only over time and exposure and the records. I can tell you that the New England Journal of Medicine has things out a few times a week on articles that people have written, or even just reports to make it available to others, and they've made this open online, so you can just go in and find these latest things, because so many things that were not expected have occurred with this virus.
Where would they find that online?
Well, it's under New England Journal of Medicine, and I think they probably have NEJM.org or something like that you might be able to find it.
So why are vaccines so difficult to produce?
Well, vaccines have always, you go back to poliomyelitis, vaccines have always been very difficult to work with, to create a vaccine that will elicit an immune response and provide immunity at the same time. With some of the vaccines in the past, they actually made the disease worse for people, and nobody was intending, and everybody was being very careful about that. But it's really a difficult thing to grow the necessary broth that can be made into a vaccine.
How do you, as a public health professional, you've spent your entire career trying to educate people about health and making people more healthy, how do you just react as a person and as a professional in the career you're in when the president will talk about injecting disinfectant and using ultraviolet light?
My first reaction is I usually can't believe it, that's what was said. So the news repeats it, and you say, I guess this is the case. I think this really is caused about by the peculiarities of the way the president chooses to put out information. The much more important issue for all of us as Americans is to have CDC, NIH, proper government agencies set up and dealing with the idea that some pathogen, some infectious agent might come in and cause a pandemic. For some reason, with various times, we've been geared up fairly well for this concept, but it's completely disappeared in the last 20 years or so. And I'm not trying to denigrate the CDC. CDC is a great agency, but you have to want to have it out there and equipped for the unknown. And we kind of lost that nationally in the last 20 years.
Well, I'd like to pick that up after our break. You're listening to Be Bold America on KSQD 90.7 FM. Many voices, one station. Listen worldwide online at ksqd.org or catch up on programs by visiting the KSQD archives or from your favorite podcast platform. I'm your host, Jill Cody.
This week on The Cutting Edge, Ashley Papp speaks with a special guest about how the way things are spoken and what goes unspoken in the college classroom can influence a student's educational success. Rebecca Covarrubias discusses her work in social psychology at UC Santa Cruz. Join KSQD for an in-depth look at cultural norms in the classroom. That's The Cutting Edge, Sunday evening at 7:30 p.m. here on KSQD 90.7 FM and ksqd.org. Many voices, one station.
Today our topic is the pandemic and democracy, and we're speaking with Dr. Peter Levin, former Dean of the Schools of Public Health at the Universities of Oklahoma, South Florida, and SUNY Albany. Now, Dr. Levin, you were just talking about the CDC, and recently I read that the administration is burying the CDC report that was 60 pages. I had flow charts that were to assist states and cities on reopening for businesses to day camps, and it turns out it was approved by the CDC Director Robert Redfield, and states and cities are hungry for this information, as well as the businesses, to make the best decisions possible, just to face this personal and economic disaster. How do you feel about the CDC report that, this is an excellent organization, just having it put on a shelf, and somebody said it would never see the light of day?
Yes, I heard those things in the news reports. They must put out something, and they'll have to work this through the administration, and hopefully an easy-to-use and successful set of guidelines will come out. The idea that we start opening things all over the country without a set of guidelines for stores, child care, schools, etc., just makes no sense. And the part of this that I read, I don't know that I read the whole thing, but I certainly read a series of guidelines that were very prescriptive, and where I think the conflict arises at the present time is the strong desire to get the country moving economically again. And that is necessary. All of us know restaurants, businesses closed, people losing their livelihoods. I mean, this is a serious thing.
It's terrible.
But at the same time, the last thing we want is another wave or waves of this disease, which will wreak havoc even greater than we've had now, because it creates tremendous uncertainty on everybody's part. Is this epidemic over? Is it going to come back? Whatever. And the best minds on this are that there most likely will be additional waves. And the only way to tamp this down is with people staying in place, not going out, and wearing masks when they do go out, which is, it's not the instant answer that we Americans like, which is, do this, take this, and you're going to be okay. And this is going to drag on and is very demoralizing. Now, one thing that we should talk about, Jill, is this whole question of case finding. And because one of our initial problems with this was that we had no quick tests.
Well, what is case finding, Dr. Levin? What is case finding?
Well, case finding, the old traditional way in public health in particular, was done for tuberculosis and venereal disease. Somebody came down with a disease, you could absolutely be certain of it from a laboratory test, and you then traced and found every person that person had been in contact with for a fairly sizable period of time. And you warned these people that, you were exposed to tuberculosis or for venereal disease, and you should come in and be tested and be treated. So it was a very clear series of expectations and results, and we used it all over the country. In the case of venereal disease, we wanted to be sure that people were taking their medication, which they had to take for a long period of time, and were constantly checked up. And this is where public health nurses from county health departments played a role. And we had special teams that went out and checked on cases of venereal disease and who their contacts had been. Well, for coronavirus, this is not the same thing. Yes, you wanted to know who had been exposed to the person with the disease, but you had no reliable tests that would quickly tell you this is a person who now has the disease or had the disease. And as far as I'm concerned, I mean, I know people, I hope in the past week, the laboratory companies have done better, but we really didn't have tests that were sensitive and specific and valid, and we floundered around for a long time. Now, if you do take a test and it says negative, and these are the things called polymer chain reaction, PCR tests, that's great. You know at that moment that the person has not been exposed to Corona-19. But the next day, that person could be exposed and be a possible carrier. So it's not a clear thing, but it certainly would make people who were exposed and had the disease and realized that it was safe for them to be around people with the disease, it would have made things easier. But it's not as though, oh, you take the test and we know you're okay. With this disease, we're not sure how long it incubates, how long you're going to be positive during that process. When do you stop shedding the virus? When are you? For how long are you immunized? Even that's not clear. After you've had the disease, 2 months, 3 months, most of us remember getting a shot for polio or measles, mumps, and rubella, and essentially you're immunized for the rest of your life. We don't even know enough about this disease yet to be able to say with certain about each of these periods of time how dangerous you are to others.
Well, there's certainly going to be, or is, a dynamic tension between the health of the public and the health of the economy. And knowing what you know now, do you have any opinions or ideas of what would be the right way to open up our cities and states, or the wrong way to do it? Thoughts on that?
Well, yeah, no, there are definitely lists of requirements that should be met before you start opening up. And they have to do with the number of cases, how it's gone down, whether the number of new cases are staying down. But first of all, you have to have a means of knowing that. And many cases are asymptomatic. In other words, you may have a mild something for a day or so, but you really do have the disease, and then you feel fine after that. So it's not as though everybody ends up on a respirator. A whole bunch of people take an aspirin and go to bed and go about their business the next day. So, and yet they could be shedding the virus, causing the disease in others, and the others may have a much more serious case of the disease. So it's a very tricky kind of thing. There are a large number of people who want to do case finding. The state of Massachusetts has announced they're hiring, I think, 1,000 case finders to go out and follow people. But you got to have a test that works when you run into people to find out whether they're positive or negative and know what to do on a population base. I mean, there are employers who want to give people a test every day to see who has had the disease and who is at risk. So it's an idea that we want to implement, but it's very difficult to do with great certainty.
Well, there seems, for me, from my viewpoint, there's an overlay to all of this. There's the public health and all the challenges that you've been talking about. It's almost like a Rubik's Cube. There's so many different ways it can be twisted and turned and different variables. And then the overlay for me is, living in a democracy. What makes America is the federal government. I mean, we would be 50 separate states, but what unites us is the federal government. And our government, one of its major jobs is to keep us safe. And it just seems to me that having states doing different things, different plans, is probably very problematic for public health officials. Am I right?
Yes, in many ways, but the other side, which you made me think of when you started this,
Good.
In some states where there have not been a lot of cases, where people do live far apart, it is possible to start reducing the amount of quarantine. Mm-hmm. And it's safe to do, and they have a history. More cases aren't coming on board, and this would really help their economy. You have to be very watchful during all of this, but it seems reasonable to do that in areas where there's not high population density and there has been a steady diminution of cases. So this makes it even more complicated. What happens in Wyoming or Montana is irrelevant for Atlanta or Los Angeles or Chicago. You got to look at the situation, who the population is, and how sick they've been.
Well, one thing that also I wanted to get back to, and probably after our break, is what is coming up with vaccines? Who's studying and what are the options that are being looked at? But right now, we'll go to break.
America, your children have an amazing superpower. They can help save lives by not having play dates. That's right. By replacing get-togethers with virtual play dates and video chats, they can help slow the evil spread of germs. And if your superheroes do go outside, make sure they continue their superhero wing by staying 6 feet away from others to protect everyone in America land. Find out more at coronavirus.gov. A message from the CDC and the Ad Council.
Newspapers can't keep up with fast-breaking news, and the internet can only reach so far. But radio is just a motion away, and KSQD is here for you 24/7. We do it with your help. You can donate at ksqd.org by clicking on Support.
If you're just joining us, you're listening to Be Bold America on KSQD 90.7 FM. Our topic is the pandemic and democracy, and we're speaking with Dr. Peter Levin, former executive director of Stanford University Hospital. I'm your host, Jill Cody. And Dr. Levin, to get back to vaccines on the race to find one, what's going on at the moment? Do you know?
Yes. Really an unprecedented effort on the part of the government and various scientific firms and drug companies. And they all say this. I saw a webinar with some of these very smart people who are highly trained in biotech and also are entrepreneurs. And one of them said, we decided to work with one another so that we're not even talking about what to do about profits. We've we've left that. He said, we left that hobby horse at the door. And we're all working with one another, sharing information in a way which we have never done before. American firms, big pharma, the small people, and even firms overseas to try to move along in two areas. One is the creation of a vaccine, and the other is creation of therapy that will work for people who have the disease. So some real progress has been made that way in the sense of moving along the frontiers of science. I mean, they've never worked together on anything like this. They also, the vaccine people, there's all kinds of things. Oh, there'll be a vaccine in 4 months. There's this and that. Most people with a lot of experience in this say, we never produced a vaccine that was safe and usable in less than 4 years. And I'm pretty confident that the system was going to produce something faster than that, because the only way we're really going to get control over this is if we can immunize people, so that you have to have a disease die out. Probably close to 2/3 of the population needs to be immunized. And with the childhood diseases, until very recently, we had virtually almost 100% of children immunized, and they disappeared when you do that. When you start fooling around and not immunizing, measles breaks right out again. I mean, it's waiting there. So I'm very impressed that there is the greatest effort to find a vaccine and to find therapies for this, and that's really terrific. But could I do something
of course.
we didn't cover at the beginning, but is really essential to this? We've got to have a government overseen system, and I purposely picked that word, that is constantly monitoring the level of disease and the number of different diseases in the population. I mean, we have the internet, we have interconnectability between things. In the old days, when I was at Stanford, you hoped that a doctor, if he found a communicable disease of one kind or another, filled out a postcard and mailed it to the health officer in Santa Clara County. Talk about craziness. I mean, if the doctor did it, then it would take 5 or 7 days between the post office and a doctor's office or a health department office before anybody even saw that there was a case of flu or mumps or whatever out there. We're in the 21st century. Every single case for payment goes through some computer system somewhere in order to pass that up to whoever is covering the payment, the insurance company, the government, Medicare, whatever. And we should have a system that every diagnosis goes somewhere and the computer sorts out those that should be reported somewhere, and that this can be done in real time. The idea that people come into the country and wander around for a while with Ebola or some other ghastly disease before anybody picks it up, or they do show up for medical care, and the medical care people in a hospital or an office or somewhere don't report it to anybody because they really don't have to, and their system doesn't allow this. This should stop. Mm-hmm. We should have a system that goes from a doctor's office or a health department or a hospital and reports the diagnosis somewhere and flags those things that somebody should take a look at. I mean, we're it's one thing to be 50 states, and there's great strength in having 50 states, but the 50 states should be taking the information that's critical to all of us and passing it along through the use of computers and various logarithms and paradigms, so that somebody is looking, and when there's something very unusual, it gets picked out. An awful lot of this can just be done automatically by computer. The other thing is, it's just hard to believe, you take something like death certificates. Death certificates are made out by the physician who pronounces the death. And to some people, it's the flu. To some people, it's something to do with a lung. To some people, it's the result of being treated for something else, and you have that in the system. So we have really not good uniformity of the definitions that physicians should be using for this for the purpose of follow-up. And every state, every jurisdiction is different. There are medical customs about what you call things and therefore code it. We're really very primitive about this, and it's great to have 50 states, but not as 50 states are calling the same disease something else when it comes to cause of death. We've got to straighten that out so we have a system that works uniformly. I know people don't think this is the case. They're sure, well, every doctor pronounces death the same way. Not so. And from a statistical point of view, it makes a great deal of difference.
So from your viewpoint, who would be or what agency would be the one to do the overseeing or create the uniformity of definitions?
Well, I think, doctors are used to doing this kind of thing, and I think that you've got to involve people from the practice world, people from the data world and state departments, state health departments who get death certificates all the time, and you figure out a way to do this that involves government, private insurance carriers, the hospitals, everybody saying, what is the best way? Let's agree on a common result, and how can we work together to implement that as best we can? There's absolutely no way on these massive health things involving multiple jurisdictions and definitions, but to have people sit down and figure this stuff out together for a common purpose. I mean, it's very hard for us as a country, for some reason, to do this, and we must do this. We don't, I always say there are worse things than the coronavirus 19. There are horrible diseases out in this world that are spreadable, and so we should be geared to preventing all of these, and not geared to, well, this is something we know how to do now. The unknown is in front of us. I mean, there's just no question about it.
Well, it seems to me, again, in my view, that the federal government would be the one to do this. I mean, that's what makes us a country. What makes us one is our federal government instead of 50 governments. But turning America into America as a federal government just seems that they'd be the ones, or the CDC would be the ones, to show the leadership to develop this overseeing and uniformity between business and doctors. And but I do have another question for you, talking about what's very important in democracy are whistleblowers. They're very necessary in democracy because they keep federal employees accountable. And I want to know what your thoughts were regarding Dr. Rick Bright, the top vaccine scientist being removed from his pivotal position right as a pandemic is raging through the population. What are your thoughts on that decision?
I have no idea about the facts that are involved in that. I saw it as a news item. I don't want to be a defender or an attacker of him, but it's very strange in the middle of all this to remove somebody like that and shift them to the side. I agree with you. Whistleblowers are important, but I'd much rather have a very aggressive, argumentative CDC talking constantly to state health departments, to universities, to medical schools, and arguing back and forth about what was the right way to do something, and then implementing it and doing it. So along the way, I hope that unjust decisions are not made. I don't know about this one, but that's the way to do things. And it's very demoralizing to have somebody pulled out of a position in the middle of a pandemic. It doesn't make any sense on the surface, but I don't know the facts.
Well, and also just to tag on to what you were saying about the CDC, that ours was the one that really started a lot of CDCs in other countries. I mean, it's a premier organization. So I, for one, would certainly like to see it out front, doing public announcements every day and not having their report shelved. Another question I had for you was, as this pandemic is spreading from coast to coast, right now the Trump administration are in the courts advocating for the complete repeal of the Affordable Care Act. That could just take health care away from 30 million people right when they need it. What are your thoughts on that?
Well, that's a separate issue, and the ramifications of taking health care away from people one way or another in the midst of a pandemic where people need to go and get medical care, may need to be hospitalized. You simply can't be taking away the whole insurance aspect. I hope that this pandemic experience will make those of us who believe that health should be covered one way or another will give us reinforcement, and we continue to do that. There is no point in removing health insurance where it exists now or leaving great loopholes and things. This country struggles with this idea of covering everybody, and it's very damaging. The biggest reason for bankruptcy is that people can't pay their medical bills, and that's just crazy. It shouldn't be, especially when we're spending 18% of the gross national product on health and medical care.
On health care, that's right. Well, after the break, I wanted to ask you about the strain on our nurses and doctors. So after the break, we'll pick up there.
Buddhism, Judaism, Baha'i, Islam, Christianity, Hinduism. Sound interesting? Faith Matters is a unique bi-monthly program that explores spirituality, life, and meaning with local religious leaders. We discuss areas of common ground and also identify distinct differences among diverse spiritual perspectives. Join us on the second and fourth Sunday evening of every month from 6 to 7 as we have thought-provoking conversations about Faith Matters on 90.7 KSQD.
And Faith Matters follows right after Be Bold America. You're listening to Be Bold America on KSQD 90.7 FM. Many voices, one station. Listen worldwide online at ksqd.org. The topic we're discussing today is the pandemic and democracy, and we're speaking with Dr. Peter Levin, former Dean of the Schools of Public Health at the Universities of Oklahoma, South Florida, and SUNY Albany. I'm your host, Jill Cody. Now, just to pick up before the break, Dr. Levin, there's been a great deal. Why has there been a great deal of strain on our nurses and doctors who care for our COVID-19 patients?
There's been a great deal of strain because this is a very unpleasant disease to treat. To protect the individual doctor or nurse or porter or whoever, they must wear protective clothing, which means real equipment. They have to have a face mask, a mask which is plastic to keep splashing from going on their face or their eyes, because this particular virus in its aerosol form can go into the eyes, and you can get it that way, not just your nose and the mouth, and they have to have a mask that protects them from this and also from breathing out. They have to wear a couple of layers, including a layer that's impervious to fluids, and the patients are very sick. I mean, the whole issue of breathing equipment and all, this is very specialized stuff and has to be maintained by a respiratory therapist or somebody really trained in it. The nurses have to be very vigilant because this is pushing air into people, and sometimes this prolongs the disease instead of helping it. So they're nervous themselves for their own health, and they're with these terribly sick patients in these uncomfortable, sweaty outfits that they have to change in between patients. And there have been a lot of writings in newspapers and magazines by physicians and nurses about how difficult this is for them and how much they hate or really dislike being with patients, many of whom are going to die. I remember a nurse from New York, a young man, saying, I had 2 patients today die and 4 patients one other day. I don't know how much I can stand this, because that's not why they went into healthcare. They don't want to be around and not be able to help these people. So it's a real strain on doctors and nurses. No kidding around about that.
Oh my! And it's a real strain on the patients. I just hope that people will understand the dangerousness of this disease, being the patient and being the doctors and nurses. And I saw that some of them, because they look like they're from the moon, approaching patients, that they're wearing pictures of their face on their outer clothing so that the patient, who's also very afraid and feels they're going to die, will at least see a face who's treating them. It's when the disease first started going around, doctors, and especially in ICUs and in the emergency rooms, were just totally overwhelmed by the volume of these patients, the attention they needed, the equipment they needed, and it was. One of them said, I tried to, a person was dying, and I tried to connect them with their family who weren't allowed to come in using my cell phone. He said, this is unbelievable strain on everybody, patient, family, doctor, the whole thing. It's really a terrible disease, and nobody should take it lightly at all, or casually, or think it as a hoax. In the last few minutes, Dr. Levin, we talk about keep, stop, starts. What listeners can keep doing, stop doing, and start doing regarding this topic. Ideas on what listeners should keep doing?
Oh, there's no question that one should shelter in place to the degree that you can. People have to go out for various things, and one should be reasonable about that, and wear a mask, and understand that the mask that most of us wear is really protecting the other fellow. It's keeping your sputum, your aerosol, from going out in the air and being dangerous. Sure, it protects you to a certain degree as well, but unless one had a mask on that was sealed certain air is going to get in. So, you have to be kind of reasonable about this. I think in Monterey County, the people really do behave in the stores. They keep distance between them. Putting up the plastic shields in front of the people who run the cash registers is an excellent idea because it keeps just normal spray from going in that direction. We've got to keep doing this till the numbers really come down. I mean, there's just no question. And then probably for a period of longer, so we don't find ourselves with a bump in the disease going up again. It's very difficult on some issues like children, where children do not seem to be as susceptible, and children need to be in school. I think we've got to make some decisions to see what we're going to do in September, and try to be as progressive as possible about that, and set up classrooms and house children move around in obviously a different way. Using computers is wonderful and a great thing, but you can't do everything that way. And parents have to go to work, children have to go to school, so that when it's safe, we should do this as soon as we can.
So what should listeners stop doing?
Well, if anybody's foolish enough to sit around in a closed room without masks, that's a mistake. I mean, one should not run any unnecessary risks or reasons for contagion. That is really a given at this point in time, and I'm sure people are getting awfully tired of it. But you'd rather not run the risk than get this disease.
So stop being impatient about it.
Yeah. Yes.
We're in it for the long haul.
We're in it for the long haul. That's another thing. We're used to, the epidemic is over. Now, you may, if we're lucky, this virus may do us a favor, and as soon as the summer is here, because apparently they like cool and dry weather better than they like warmer weather. If we're lucky, it may slowly disappear. Now, even that, relative to some of the other epidemics we've had, people act like, well, it disappeared. Well, in some cases, yeah, it did disappear. But in other cases, it was vigilant case finding and treatment of people and people behaving in a smart way that stopped the spread of the disease. I mean, what they've managed to do in Hong Kong and Singapore when confronted with SARS, I mean, they really shut things down and did case finding and stopped it. And it was for our benefit as well as them. I mean, this is a worldwide problem and has to be treated that way.
I heard one person say, my mask protects you and your mask protects me. And I think that's a really good way to remember it, that wearing your mask is really important. And I guess in a start is if you're not wearing a mask or not being consistent with it, start doing that.
Absolutely. I mean, it's not a time, as people think, well, the disease is dying down. Not yet. We're not in that position yet.
Mm-hmm, mm-hmm. So I want to thank Be Bold America's Dr. Levin for being a bold guest on our program, and also my program engineer, Emily Dunham. And Dr. Peter Levin, I was really encouraged when you said you were impressed about what was happening with vaccines. That made me feel hopeful, that we've got some hope on the horizon. So thank you for giving us a little hope.
Well, thank you for the really excellent questions. And I think there is some hope there, but there's still an awful lot of public behavior that's going to have to be controlled for well into the fall and maybe beyond. So even with because the vaccine won't, just won't materialize immediately, and everybody's going to get it. So it's a while yet, but real progress is being made, and I'm very pleased that the companies are working like this.
That's wonderful, and we just need to be patient and know that we're in it for the long haul. Next on Be Bold America will be Stealing Our Democracy. This is a very special program on Be Bold America, and I'm going to take a little longer to describe it than I normally do. We will be speaking directly with former governor of the state of Alabama, who is known as America's political prisoner number one. Governor Siegelman was featured on CBS 60 Minutes, and his story is the subject of a documentary titled Atticus and the Architect that you may watch for free on Prime Video. Governor Siegelman has now written a book titled Stealing Our Democracy about being targeted by Karl Rove, Jack Abramoff, and others who were successful in sending him to federal prison using a corrupt judge for a crime that wasn't a crime. This outcome was observed by 100 attorneys generals, both Democratic and Republican, who wrote a letter to President Obama trying to secure Governor Siegelman's release. But Obama did nothing. Hear about his life in federal prison, being targeted by Karl Rove, his abandonment by the Democratic Party, and his new mission to create substantive changes in the criminal justice system. Don't miss Stealing Our Democracy on Be Bold America, Sunday, May 24th at 5 p.m. If you missed any part of this program or would like to hear previous programs, you may find them on KSQD's website or at Apple Podcasts, Google Podcasts, Spotify, Breakers, Radio Public, and Pocket Casts. You're listening to KSQD Santa Cruz, Many Voices, One Station. Listen worldwide online at ksqd.org. Stay tuned for Faith Matters with Seth Shapiro. My name is Jill Cody, and thank you for listening to Be Bold America. Until next time, keep, stop, start.